Schultz with Young Invincibles, and I'm here to tell you about how health insurance can fit into your financial well-being. Having health insurance isn't just about access to healthcare, it's also about financial protection. We all know healthcare in our country is expensive, and health coverage adds a protective barrier against high bills and medical debt. 3 in 5 uninsured or underinsured Americans face medical debt, double the rate of people who have adequate insurance. Yes, health insurance is an additional line item in your budget, but with improvements to the Affordable Care Act, monthly costs of coverage are getting more manageable for millions of people. So let's talk about what's available in terms of where to get coverage. Young people have several options. About half of Americans get their health coverage through their job, but we know that's not an option for everyone. Not all employers offer health insurance to their employees. Under the Affordable Care Act, young people up to the age of 26 are able to remain on their parents' plan. If your parents have insurance, ask them if you're able to join their plan. Additionally, Medicaid offers an affordable opportunity for people with lower incomes to get covered. Medicaid has been expanded in many states and offers no or low-cost care. For those who don't have access to any of these options, the health insurance marketplace is there for people to buy their own coverage. In most states, including Illinois, some states have set up their own websites. If you don't know where to find your state's marketplace, you can visit healthcare.gov and it will direct you to the right website. If you're going to shop for marketplace coverage, there are a few things you should consider. First, think about your own healthcare needs. How often do you go to the doctor? Do you see any specialists? Do you take any prescription medications? Obviously, no one can predict when they're going to get sick or injured, but answering these questions can help you make a rough estimate of how much you spend on healthcare on a regular basis. Next, you'll want to think about how much you could afford to pay out of pocket in extreme circumstances. If you got into a car accident, for example, and had to pay for medical care, how much would you be able to cover? And then last but certainly not least, what will your monthly budget allow? Health insurance comes with a premium, the amount you must pay every month to maintain your coverage, just like you pay rent every month to maintain your housing. Luckily, when you're shopping on the health insurance marketplace, 9 out of 10 people qualify for financial help to lower this monthly cost. In fact, millions qualify for plans with $0 monthly premiums, so this is an option definitely worth checking out if you're looking for affordable coverage. Additionally, all marketplace plans must offer comprehensive coverage, meaning they cover a broad range of benefits, including doctor's visits, prescription drugs, mental health care, maternity care, and many other services. On the marketplace, health plans are divided into 3 different categories: bronze, silver, and gold. You can imagine how these work. Bronze plans cost less monthly, but they cover less when you need medical care. Gold plans cost more monthly, but cover more when you need medical care. Silver plans, those are the in-between. Bronze plans often come with high deductibles, the amount you must pay out of your own pocket before your plan starts to cover anything. On the other hand, gold plans generally have lower deductibles, so your plan will start covering you much sooner. For example, if your deductible is $1,500, your insurance would not start paying until you have paid $1,500 for medical services. When you're considering which plan is better, you have to look at the deductible in addition to the monthly premium. Remember, while those low monthly cost bronze plans look good for their low prices, if you need care, you'll be paying more of your own money up front. And again, silver plans are in between, more moderate prices for more moderate coverage. The out-of-pocket costs don't end when you've met your deductible, though. When shopping for coverage, you'll also want to consider things like copays and coinsurance. Copays are set amounts you pay for medical services, even after you've met your deductible. For example, you might have a $20 copay when you go to see the doctor. When you go to the doctor, you'll be asked to pay $20, and that will be the extent of your bill. In most cases, copays are how you pay for things like doctor's visits, specialist visits, and prescription drugs. So, if you know you're going to be using these services, you'll want to consider the copays in your plan. If, when you go to see the doctor, they order lab work, this may be subject to what is known as coinsurance. Coinsurance is a percent of the bill that you will be asked to pay. For example, if your plan pays 80% coinsurance, that means when you get a bill, you will be responsible for paying 20% of it. So, if that lab work your doctor ordered costs $100, you would be responsible for $20. Yes, insurance is a lot of math, but your money matters, and it's all the more reason to do your homework when selecting a plan. And there's an upside. All marketplace plans come with what is known as an out-of-pocket maximum. This is the maximum amount you will have to pay for medical care during the plan year and includes the deductible, copays, and any coinsurance you might pay. For example, if your plan has a $3,000 out-of-pocket maximum, you know you will not pay more than $3,000 of your own money for medical care during the year. Even if you use $100,000 worth of medical care, your bill will be no higher than $3,000. Lastly, consider each plan's network. Most doctors and medical facilities belong to a network, meaning they contract with certain insurance companies. Before you go to a doctor, specialist, hospital, or any other medical office, you'll want to make sure they are considered in network with your health plan. Otherwise, if you go to a provider who is out of network, you're likely to end up paying most or all of the bill for services that you receive. And the same goes for prescription drugs. Not all health plans cover all medications. If you take a medication, you'll want to confirm your plan covers it and how much it will cost. You can do this at healthcare.gov by searching your preferred providers or looking at each plan's list of covered drugs called a formulary. In the end, there's a lot of thought that needs to go into shopping for health insurance. While monthly cost should be a consideration, it shouldn't be the only consideration. There will never be a best plan. What is right for someone else might not be right for you. Selecting the right plan for you is a delicate balance of cost and health needs. While you can give your best estimate for what the future holds for your health, insurance is meant to be there for the unexpected. How much protection do you want, and can you afford if the unexpected happens? Even if your budget is low, some protection is better than no protection, and all plans offer free preventive care, which will protect your health and your money in the long run. If you have questions about shopping for health insurance, free expert help is available. Visit getcoveredamerica.org to find free enrollment assistance near you. Thanks for watching.